Good evening, ladies and gentlemen. In Mary Poppins, Uncle Albert, when he laughs, not only is his spirit lifted, he's bodily lifted up to the ceiling. You know, laughter is indeed the best medicine. Laughing and crying are very close to each other, basic responses of the brain stem, the limbic system. Very closely related. You can laugh tears of joy. I think I'd like to start this evening by bonding us together in laughter. And this is ancient laughter, a yoga laughter called hasya laughter. Hasya in Sanskrit means laughing. So we're going to do laughing yoga to start with. Now I'm going to ask some volunteers. Caroline, would you come and join me here? John Bruce, Alan Watson, my friend, neighbor David, come and join us in the top, please, here. And face the audience. Now, you can't do yoga without standing up. So those of you who can manage, please stand up. A hearty laugh, a child laughs 400 times a day, as you saw. We are lucky adults if we can laugh 15 times a day. 20 seconds of laughter is equal to 3 minutes of rowing. 1 minute equals 10 minutes of rowing. And 6 minutes of laughter is an hour's rowing. So ladies and gentlemen, we are going to do an hour's rowing today. Laughter. Now, you all copy me. First easy laugh is the appreciation laughter. We go, you all copy me. And if you appreciate something, food is good, the painting is lovely, you go, come on, copy me, copy me. This is the humming laughter. The next is a girly giggle. I can't hear you. The next is Sid James laughter, dirty laughter. You got the, no. You've got the girl in a corner, you're going to have your wicked way, so you go, The next laughter is a milkshake laughter. Imagine a tumbler of milk in one hand and one empty tumbler. So you transfer the milk and go, Come on, join me. The next type of laughter is greetings laughter, like Father Christmas. So to each other say, ho, 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 ho. Turn around and say to you, behind you, ho, 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 ho. But the hearty laughter is with both hands. Please sit down. Thank you very much. Thank you very much. Thank you. Thank you. Sorry? You know, yes.
We got turned off once on our campsite for making too much noise laughing. So we did silent laughter, and it goes like this.
Thank you very much. Now, you know, lots of things happen physiologically to the body while we laugh. Okay? Our cortisol levels go down, our epinephrine levels go down, we get endorphins being released, and we got the growth hormone being released. So we all feel happy, bonded. It is very difficult to feel sad or anxious or angry when you're laughing. And it bonds us all together. Laughter is a response to the passing away of danger amongst the primates. As soon as danger is past, you laugh. You say boo to a child, and the child's scared, but then the child realizes there's no danger and responds with laughter. So laughter is very close to crying. And in this life, when you feel that you are facing a disaster, you have a choice. You have a choice. You can cry or you can laugh. Laughter, You can laugh at anything. It doesn't have to be a joke. It doesn't have to be a specific funny situation. You can laugh with people. It's very strong, very bonding. You can just laugh and it spreads and it reflects back on you. And so laughter is one way of coping with problems in life. It gives you a chink of hope to cope with it. Well, I've already said that it's a priceless medicine which is fun, which is free, and which is easy. I am a very lucky man. I had a very happy childhood. I was born in India because I was very close to my mother. And I was brought up, graduated in medicine by the age of 22, and was lucky enough to get my fellowship by the age of 26. And after that, I've had a charmed life. One of the first medical meetings I attended was by a professor of medicine in Mansfield. And I was under 30 at that time, and he said that the average lifespan of a GP in the United Kingdom is 55. Because many GPs die young, or many hospital doctors die young, through coronaries, through drinking or drug addiction, or it's an unhealthy life. We sit in a chair, stressful life, we often drink heavily, we take very little exercise, and we eat rich food. And many of us smoked in those days. So I said to myself, I'm tailor-made to go at 55. So I lived life in the fast lane and did everything I wanted to do in this world by the age of 55. And every day since the age of 55, I'm now touching 68, has been a bonus, has been wonderful. So I'm a very privileged, very lucky man, and I had no past medical history. I was wonderfully happy and healthy. But my surgical history was a shock to me and to people I know and to my family. I had painless hematuria in 2004, and it turned out to be carcinoma in my right kidney in the upper lobe, and it was already 9 centimeters before there were any symptoms. So I had to have a nephroureterectomy, which I had within a week or two of the diagnosis. And then in 2005, oh, it's coming. I had metastasis in my right lobe of the liver and the inferior vena cava. Metastasis in 4 parts. My colleagues in Nottingham had a look at my scans and said the caudate lobe is involved, the inferior vena cava is eroded, it's inoperable. But we'll get a second opinion in Birmingham. So I was sent to the Birmingham liver unit, and they had a look at me and my scans, and they said, sorry, mate, it's inoperable. So if a patient had come to see me with that sort of history and diagnosis, I would have given a few weeks. So I knew that I was on my way out. But I saw a local oncologist, professor of oncology, and he said interferon is an old-fashioned drug, which I had heard about in medical school. So it's quite an old drug now, because I read about it in the early 60s. And he said it only works in a quarter of the patients. We'll try it on you. I said, yes, please. I've got no other hope. So we tried interferon. And it shrank my metastasis. And in 2006, I had my right lobe of the liver removed, and my inferior vena cava explode. That was a big operation in Leeds, St. James's, and I was lucky enough to sail through it, no problems. But then in 2009, a small nodule appeared in my right lung, so I had metastatectomy in the city hospital. And then in 2010, I had another nodule in my left lung, and that was removed, and that turned out to be another primary, a carcinoid tumor. Now, with that sort of history, I'm now cancer-free. My last scan was totally clear. Every day of life is a bonus. Life, I don't believe, is my birthright, but it is a bonus. Every day is wonderful. Every day I wake up and I say, I'm so glad to be alive. I've never suffered any anorexia, never lost any weight, never lost my taste for drink or my eye for women. I've been very lucky. I've been hugely lucky in this world. And I wake up every day and I say, I'm going to make somebody happy today. And I hope I've contributed by making you laugh together for today. Now, 1 in 3 people in the United Kingdom get cancer in their lifetime. So it's fairly common. 298,000 are diagnosed every year, and 160,000 people die of cancer in the United Kingdom. But over 50% are still alive after 5 years. So the diagnosis of cancer is no longer a death certificate. That's what I feel, and I really believe. Because every day the prognosis is improving, and more people are surviving and beating it. So you never give up if you have a hopeless diagnosis. You must have the will to fight it and beat it. Because I really do believe that positive thinking does help to beat this illness. Your mental state, your will to live, your will to fight. When I was told I had inoperable cancer and only a few weeks to live, that was a shock. I wasn't prepared to that. So the first thing I did was find my stock of Havana cigars. I don't smoke, but I did light a cigar and went out in the garden. And this was in November. And I said, I'm going to live at least till the spring. I love flowers, I love gardening. So I planted 250 daffodil bulbs. I said, I must see them bloom till next spring. So I gave myself a goal. And what else do I want? I said, I'm going to throw a party. Because when I die, people will come, some people will come to my funeral and say nice things about me. I said, well, that's not good enough. I want to hear them. I want to say what they got to say. So I invited, with my wife and family, 220 people came, and they said very nice things about me. I can't remember much of it, but it was a wonderful party. So I got a taste of what my funeral is going to be like. Being a patient and having 4 major operations, I have every hope that I won't be going back again to hospital, but you never know. So I always have a bag packed. And ladies and gentlemen, we all need a hospital someday. Whether we like hospitals or not, doctors or not, we need the hospital when the time comes. And when the time comes, we are very grateful that there are specialists in the field who are going to help us. They're going to hopefully get rid of a problem and cure us, or make sure that we are comfortable and do not suffer pain. I have no doubt that nowadays anesthesia is very safe. Hospitals and what the surgeons do is very safe. But lay public don't know that. Hardly anybody dies on the table in elective surgery or due to anesthesia. But general public don't know that. But there are still dangers of being admitted in a hospital. People still die in hospital, but not from what you might think they do. Because mistakes do happen. Still happen. The main culprit is deep vein thrombosis. You know, when our patients travel abroad and they go to the developing world, we say, oh, have malaria, typhoid, cholera, yellow fever vaccination, hepatitis, Japanese encephalitis, do this and do that. Nobody dies of these illnesses. The number 1 cause of death is road traffic accidents. So we should tell our patients, it's road accident that's going to kill you. Number 2 is drowning. People drown on holidays. Swimming pools and rivers and oceans, they don't know the currents, local conditions. And third is alcohol-related problems. Similarly, when patients go to hospital, they die of deep vein thrombosis. Every year in the United Kingdom, 100,000 patients get deep vein thrombosis, out of which a third are fatal due to pulmonary embolism. We don't tell our patients that. But there's a lot that the patients can do. The doctors will do their bit. Anticoagulants, graduated pressure stockings, or intermittent pneumatic devices, fine. But a lot a patient can do. Electronic beds, they should press the buttons and raise their legs, drain their blood away. Sit up, move position. So we must tell our patients not to lie still for too long in bed. Similarly with chest infections, we should teach them about breathing exercises and hospital-acquired infections. I have a thing or two here to say about hospital-acquired infections. Since publicity of MRSA, the figures have gone dramatically down. There used to be 1,500 deaths in the year. With MRSA now they're down to about 600 to 700 because of publicity. Everyone's very careful not to spread MRSA, and there is a lot of protocol in place for that. It's not MRSA. More patients die from Clostridium difficile. That kills about 10 times more patients than the dreaded MRSA. Many patients can help to prevent MRSA or hospital-acquired infections by washing their own hands. When I was inpatient 4 times, I noticed my fellow patients didn't bother to have a shower for days, didn't bother to change their pajamas for days, didn't bother to wash their hands with soap for days. This is what we should be instilling in our patients, that you look after personal hygiene. Cut your nails before you go to hospital. It's always self-induced, could be self-induced infection. Always take disposable slippers in hospital. This is Hilton Hotel. So when you're discharged from hospital, throw these away. You don't want to bring hospital bugs home. The other advice I give is that if you've been in a hospital bed with some serious illness, the first time you're going to open your bowels, you're likely to need a commode. Okay? And you're only likely to be separated from other patients by a thin curtain. It is a good idea to take with you to hospital a radio and a spray. It is kinder to your fellow patients. You must take a long-handled brush. It is necessary to take an iPad. This is Virgin Airways. And properly fitting earplugs. Hospitals are noisy at 3 and 4 in the morning. You need your sleep. You need to recover. You need Lipsil. Hospital air is dry. You need to take acyclovir with you. If you are prone to having lip sores, cold sores, at the first sign of burning, you apply acyclovir. Take things with you. And lots of other things that you can pack, which I'm not going to go into now. But there is a booklet I've produced, which Tanya will have at the end of the talk, which you can have, and the proceeds go to charity. You must have a bath. I'm sure all of you change your clothes at least twice a day and have a shower or a bath every day. Why is it in hospital we stop having a shower? That's where we need it most. Now this reminds me of this lady who came out of the shower, and at the same moment her husband arrived home and he went into the shower. As soon as he was in the shower, the front doorbell rang. So the lady wrapped a towel around her, went downstairs, opened the door, and it was Bill from next door. Now Bill saw this attractive lady with the smelling of lavender and with a little towel around her, and he suggested that if the towel were to accidentally drop, there were 900 pounds in cash for the lady. Now ladies, you must agree, 900 pounds is a lot of money. So the towel accidentally dropped, she picked it up, wrapped it around, she had 900 pounds cash, she went upstairs, her husband said, "Who was that at the front door?" She said, "Oh, it was nothing, it was Bill from next door." He said, "Oh, good. Did he mention the 900 quid he owes me?" The commonest hospital-acquired infection is urinary tract infection. especially if you have an indwelling catheter. After 6 days, the incidence of urinary tract infection skyrockets. Don't assume that your consultant knows that you still got the catheter in, because catheters are always hidden, out of sight, out of mind. The more senior the consultant, the less likely he is going to know whether you got the catheter. So ask every day, when is your catheter going to come out? Because that is the commonest infection that you can pick up. I'm going to move on. Living after major surgery, a few things change. You can't drive straight away, and it's your responsibility to inform DVLA. And the bed at home is always too low compared to the hospital bed. It is easy to slide in and out of a hospital bed. So when you come home, you need sturdy furniture very near your bed to help you out. The body shape alters if you've had surgery. I find that my right side now bulges quite a bit from my left side. Otherwise, I used to be very slim. I still like to travel, and I was lucky enough to have critical insurance. So I would recommend those of you who have not had any serious illness to consider having critical insurance, because I got paid lump sum because of my critical insurance, which helped quite a bit. Travel insurance is another thing. When you've had a history like me, like mine, it's not easy to get travel insurance, but it is still available. I wanted to travel, still continue seeing the world, and a colleague advised me, contact Bupa. Bupa do a policy only for doctors, not for anybody else, but only for doctors, and will cover you against any illness which you declare, only overseas, not within the United Kingdom. So no matter how hopeless your diagnosis is, Bupa will insure you overseas. It will cost you an arm and a leg, but it was worth my while, and I got the policy. But only 6 months later, my bank contacted me and said, would I be interested in a black card? Have you heard of the black card from NatWest Bank? Well, NatWest Bank do a black card. It's not more expensive than other cards, but it gives you unlimited foreign travel at no extra cost, no matter what medical background you have, and covers your family. So I was lucky enough to be insured with them for the last 6-7 years, and that covers me insurance-wise. So it's worth looking around and not giving up your lifestyle and everything that you enjoy doing in life just because you've had a serious illness. Well, I had to give up my membership of the golf club because I didn't think I could justify paying the fees, because I wasn't going to play as often. And I joined the bowls club, which I enjoy immensely. And contrary to what you might think, bowls is a very competitive game. And it's as competitive as golf. Isn't that right, John? It's very enjoyable, very competitive game, and it's not an old man's game. It needs a lot of skill, and now's the time to join a bowls club. It's wonderful. I took up topiary. I live in a garden which is about 60, 70 years old. So when I was having interferon injection and couldn't do much, I still could move my arms. So I shaped everything in my garden for the whole year. So I've got an octopus, I've got a pig, I've got 5 elephants, I've got an eagle, I've got a yacht, got a bear. So every bush that I could shape something into, I spent all day doing that. And then I took up painting, which I enjoyed. Roles change. When you're sick, when you live as a patient, it's not only you whose life is turned upside down. It's your family's life turned upside down, especially your spouse's life. She has to make sure that you're comfortable, that you're safe. She can't do anything independently anymore without considering you and often putting you first. So consider your spouses. Their life is turned on its head. And my wife did all the portering. She had to do all the gardening. She lit candles in every church she went to. I was on the prayer list in the Woollerton St. Leonard's Church. And she wore a power bracelet, which she thought has kept me safe. Bought me Maluka honey, Actimel, daily fruit salad. I had lots of pampering. The whole family it brought close together. We have always been very close together in my family, with my children and grandchildren. We are very physical. We hug and kiss each other a lot. But since my illness, that increased an awful lot. Is my daughter here somewhere in the audio, Roma? Hi. Would you agree? Yes, there's my beautiful daughter, Roma. My wife is in a fashion show tonight. She can come. So that changes one's life. And often we forget the spouse of an ill person. And often as doctors, we don't consider the other people in the same family and how it affects them when somebody is seriously ill. We should put in some extra time in looking after the spouse's needs and the family's needs when we are caring for patients with serious illnesses. One needs support from one's not only family but friends. Everybody has friends. They all want to help you. But do you know, the reflex answer is, no thank you, I'm fine. Very kind of you. And people say, if there's anything I can do, give me a ring. And you never will ring them. So if your friends say to you and you're ill, is there anything I can do to help you? It's up to you to break the ice, to give them something to do, because they do genuinely want to help you. If anybody asks me, how are you feeling, is there anything I can do? I used to say, yeah, lend me a $5. And you know, one did and I accepted it. He's here. But not many people will lend you a $5, but it breaks the ice and it relaxes the tension that there is when you're seriously ill. Because many people find it difficult to talk to you because they know that you haven't got long to live. Some people may think they might break down or say the wrong thing or upset you or not visit you. And if they don't, you would feel unloved and neglected and uncared for or hurt. But I say as a patient, it's up to you, up to me, to contact the people you love and care for and ask them to visit you and give them some tasks that they can comfortably do, like driving you to the bank or the post office or to the florist to buy flowers for your wife. Any friend of yours would be happy to do that, or to read to you, or watch a video with you, or play any games, or bring you plants or magazines or books. One of my friends even offered, when I was told that my condition was inoperable in Birmingham, my GP friend had just received his retirement lump sum. He said, I've got this lump sum in cash, it's yours if you can find somewhere in America where they can perhaps operate if it's not available here. And I shall never forget that. And when I told that to my father, he had a tear down his cheek, that I had a friend like that who would offer his lump sum, and he meant it. So do ask your friends to do something for you. It gives your family a little relief for not being responsible for that particular time when somebody else is sitting with you. I've always enjoyed traveling, and this is an eclipse that was photographed in Zambia, and so we went to see one in Tunisia as well, and it's a very moving experience if you see a total solar eclipse. There are some events that are not very helpful if you're seriously ill. People come to me and say, how are you feeling? And I give them the honest truth. I say, I feel great, wonderful, it's lovely to be alive. I'm enjoying life to the full. But they don't believe me. Then they go to my wife in the corner. Now the truth, how is he really feeling? I think she feels that that is sometimes a burden for her to keep explaining that I really am well. So that is not helpful. I think patients are entitled to a fair appraisal of their clinical condition and prognosis. But we as doctors should hang back slightly and not give a diagnosis and say, fait accompli, this is it, mate, you got 3 weeks or 3 months, or there's nothing else left. That's it, gone. We should say fairly and honestly that it's a very difficult situation. almost a hopeless situation, but hang in there. Because the world is full of people who have proved doctors wrong. The world is full of people who prove doctors wrong. And you as a doctor just might be one of those who might be wrong, no matter how the odds are against the patient. So just give a little chink of hope, maybe 0.1%, but that chink is necessary because it helps the patient to cope. It's a coping strategy for a devastating condition. When somebody says you've got inoperable cancer, just give them a coping strategy to absorb the information that is so nasty. So always leave a little bit of hope with the patient, no matter how desperate things are. I had to cancel various bookings that I had as a professional speaker in different places, and it hit me hard when I went to Jessop's with my wife to buy some cushions. And the cushion said, lifetime guarantee. And and that hit me hard. I said, I've been told I haven't got long to go. But there we are. Living as a patient, I would suggest, whether you're a patient or not, your spouse should be familiar with your assets and your financial situation. Simplify the accounts, see your accountant, see your solicitor. I wouldn't be surprised if in this room, and you are the cream of society, well-read, respected citizens, that there might be some of you in this room who hasn't made a will. There might be somebody in this room who handles the finances of the home entirely on their own without involving their spouse. I think it's about time that we all had a will and we all involved our spouses so they knew exactly our situation with mortgage, investments, and other things. I had to visit India and see my family there before I subjected myself to any major operations, see my family and friends there, and they were very, very kind, held lots of parties and said lots of nice things. One thing I'll mention here, one strategy I read in one of the books I read, you have to be positive with hopeless illness. You still got to stay positive. And one of the things I read which has helped me is to imagine a blue fluorescent light above your head. Invite it into your body, so your body becomes blue and fluorescent. You can actually will yourself to do that. And then as a person, as a medic especially, you know the exact site of your lesions, your nasty cells, and focus that lesion in the nasty areas and zap them. Just like I used to use laser in bladder cancers. So I made that laser, imaginated laser, come in my body, and I aimed at the parts of my liver or parts of the vena cava or part of the lung where the tumors were, at least 2-3 times a day. Willed myself to focus my energies into the nasty cells and to destroy them. It worked on me. So that blue light, it's not just my experience. I've heard from many other survivors of illness, especially Lance Armstrong, who had metastatic testicular cancer, including metastasis in his brain, and he willed with this light to destroy the tumors, and he went and won the Tour de France, the toughest cycling race in the world, after his treatment. I have nothing but praise for City Hospital and my colleagues who looked after me, and I have nothing but praise for St. James's Infirmary in Leeds, exceptionally clean. When I woke up in intensive care unit, I was lying flat and I could only see the top of my dressing. So I looked down and I couldn't see any further. So I asked the Yorkshire nurse, I said, how far down does my scar go? And she bent down and whispered in my ears, from the tits to the tail, love, and a bit on the side. I understood her precise anatomical description about my scars. I developed left ventricular failure because I was aware that I could get dehydrated after major operation, and although I had drips attached to me, there was a jug of water and I kept drinking. I don't know whether I drank too much, but I went into left ventricular failure. I couldn't breathe, and I knew exactly what had happened, so I was still in high dependency unit. I called the nurse, and the anesthetist came, gave me intravenous Lasix, and I was just like that, felt much better. But the X-ray confirmed that it was pulmonary edema. One thing I didn't like in St. James's Infirmary was in the morning, they would bring you breakfast, and it was a slice of white bread and a solid tablet of butter, which you can't spread on white bread. So when I was discharged from the hospital, I'd bought a toaster in India which worked on AC and DC, but not on bread. No, I jest. I presented the ward with a toaster which could do 6 slices at once. So I hope the other patients appreciate that, because nothing I long for more as a patient than warm bread. On the last day of my discharge from hospital, my wife rang up and said, "You have a letter from the Prime Minister." I said, "Oh, yes, open it." She opened it. She said, "Oh, you've been awarded the MBE." I couldn't believe it. I said, "Are you joking?" She said, "No." But apparently she knew, and my family knew, and my close friends knew who had instigated it. So on my last day, I felt very humble to be awarded the MBE, which Her Majesty very kindly gave me, and that's one of the best days ever in my life. That was wonderful. In a new life, after serious illness, you have to learn a few new skills. You have to know your limitations. My dad always said to me, "Son, there'll always be somebody better looking than you." I doubted him. "There'll always be somebody wealthier than you. It doesn't matter. Let there be no one more contented than you." So I have known people healthier than me, wealthier than me, taller, slimmer, better looking than me, but very few people are as contented as me. That was my father's teaching right from the beginning. He said, never get into debt. Always save. From the first day you start earning, save something, put something away for a rainy day and for your retirement, which I followed his advice. And he's now 96 yesterday. I spoke to him. Wonderfully fit and well, half my size, twice as fit. But his advice mattered. And my mother taught me, my mother was a doctor, and she taught me to challenge things, not accept things as they're taught and as you're told. Always reason things out, always look for evidence. So I think that combination has helped me in my life. So I had to learn new skills. Sometimes you need courage, and it is so essential to write thank you letters to people who have been kind to you in hospitals, who have helped you. I always noted down names of the porters or doctors or colleagues or nurses or physiotherapists who were kind to me. They've all received complaints in their life, I'm sure. But a thank you letter goes a long way. So always wrote and thanked them. Do you know, all of us, when we are walking the hospital corridors, we look at eye level. We don't look below our eye level at waist level. We don't. And I experienced that as a doctor. Everybody in the city hospital knew me because half of the staff were my patients. And most of them were my colleagues, the professionals. But when I was in a wheelchair, carted from one end of the hospital to the other for x-rays, nobody saw me in a wheelchair. People don't give you eye contact when you're in a wheelchair. People don't look at you in a wheelchair. They only look at the people who are walking past. And one porter recognized me. He said, "Hi up, Dr. Seth, what are you doing here?" I said, "Well, I had cancer in my kidney, and it spread to my liver and to my lung." He said, "Other than that, are you all right?" I said, "Yes, thank you," and he went away. I thought that I should make myself mobile as quickly as possible to avoid the complications. And I think I did too much. On the 2 weeks after my nephrectomy, I went and attended the Medkai ball, and that was a mistake. I felt every bump in the road. It's painful post-operatively. And after my partial hepatectomy and inferior vena cava exploration, I went to see James Bond film. I still had stitches in. I think that was a mistake too, because my wound gave way and I had to be restitched, and that wasn't fun, because I was awake all the time and it was restitching all the way. But then we went to Madeira and to lie down in the sunshine, and that helped the healing, because that took a while. My life has changed for the better. Do you know, I can honestly say that. My life has changed for the better. I really, really admire nature. I'm so grateful for my family and friends. I've always been lucky with my family and friends, and I'm certainly closer to my family. Love them dearly, like we all do. But I'm also find that I'm closer to nature. If I see a sunset, if I see beautiful flowers, they move me. We went to see Bush Art Gardens in Vancouver Island, and the colors were amazing in a quarry background, and my eyes welled up. So I find that I've become more lacrimal. I went to see recently the carving by Michelangelo, Pieta, in St. Peter's Church in Rome. Mary with dead Jesus on her lap, and the expressions on the face of Mary. It wells your eyes up. It's fantastic. Last month, went to see the Taj Mahal for perhaps the 20th time, and the eyes welled up again. I find that I have become more emotional, but I'm not ashamed of it. I think it's wonderful to appreciate nature in depth. There's so much beauty around us that we are often too much in a hurry not to appreciate it. I saw a painting in Rijksmuseum in Amsterdam recently. I can't even remember the artist's name, but I can describe the painting to you. It was a painting of a group of people at sunset looking behind them like this and going in that direction. And in the foreground of the painting were three shadows of three crosses. So it was obviously at the end of the day of crucifixion. But the painting was so touching. I can't remember which Dutch master had painted it, but again, my eyes welled up when I saw that. Wonderful. So sculpture, paintings, gardens move me much more than they moved me before I became ill. Is there an advantage? If you're a doctor, yes, there is definite advantage. You have quick access and quick results. Do you know, sometimes I feel sorry for my fellow patients. They're suffering from cancer. They have a scan every 3 months or 6 months. But after they scan, they often have to wait for 10 days or 2 weeks for the result. Whereas the results are known, if not the same day, the very next day. I think we should be kinder to our patient and have a system of letting them know, especially if they're cancer-free, to say your scan was okay, you can relax. Because most of us, even including me, we live our lives from one scan to the next. And as soon as I know my scan's okay, I ring up my agent, yeah, book me a couple of cruises. It's wonderful. So I live from one scan to the next. So I think we should be kinder to the patients. Because we are doctors, we have quick access. We should have quick access to results as well. We can avoid the pitfalls that are there, and that I was talking about DVT and chest infection, hospital-acquired infection. And I mentioned the wheelchair already. Doctors treating doctors should not cut corners. Do not assume that your colleagues know everything that there is to know, or don't assume anything. Treat them as you would treat a patient. Because when you're yourself in such a corner, such a situation, you don't think clearly. You don't absorb everything the doctor tells you. I think I do, but not everyone does from time to time. Are you sure he said that? Did he say 6 weeks? Did he say 8 weeks? Did he say 3 tablets or 4 tablets? Did he say I need a scan now or in a month? So treat your patients, if they are a doctor, as if they were any other patient. It is so important to give eye contact because sadly, many of our younger colleagues are looking at the screen rather than the patients. And that sometimes you feel that you're superfluous there, that it's a machine that's treating you rather than a person. As you know, I was a GP tutor for Nottingham University for many years, and I used to often tell my colleagues and medical students that it doesn't matter what the patient has come with you, you never cut corners, you always take history, you always examine them. But when you examine them, somebody's come with an abdominal problem, a chest problem, don't go for the abdomen, don't go for the chest straight away. First thing you do is shake the hand and take the pulse. This means I'm your friend. This means I'm a professional friend. I'm here as a professional. Always hold your patient's hand, always take the pulse. It doesn't really matter whether you count it or not. It doesn't really matter what it's telling you. Often it doesn't tell you anything. But it's just the ritual. Then the next thing to do is a hand on the shoulder and say, may I see your tongue, please? Oh, thank you. Beautiful. And then always look at their eyes. Look up. There is so much communication between a doctor and a patient, it doesn't matter what the patient has got wrong with them. Never cut those corners would be my advice to any colleagues in medicine till time immemorial, till kingdom come. We should never cut corners, never rely upon machines and diagnosis and investigation entirely. They are all there to assist us, but the human touch, the bedside manner will always remain important for a patient's point of view. Well, most of us, in the survey I came across, 66% of the population in the United Kingdom have not discussed their funeral with their spouses. People don't talk about death, about funeral. I think it is important to have a good death. I think so. Because in Indian philosophy, the death is a celebration of life. We are grateful to have lived so many years, to have enjoyed so many pleasures on this earth. We are fortunate. We should celebrate that. So a funeral should be a celebration, a party atmosphere, food and drink. I've told my wife, no black ties at my funeral. Okay? I wanted a party. I want music like Imagine, No Country. Okay? John Lennon's song. Sound of Silence, Garfunkel. A Wonderful World, Louis Armstrong. These are the songs I'd like when the time comes. Grandchildren give you immense pleasure. Those of us in this audience who are lucky enough to have grandchildren, they give you the will to live. They give you unpolluted love, unconditional love. It's the real joy. My grandson, Billy, tucked Roma's skirt and looked up and said, Mommy, what will I be when I grow up? And she looked down and said, don't be silly. Boys never grow up. And he came home from school and I said, Billy, what did you learn at school today? He said, Granddad, I learned about the equator. I said, oh yes, what's the equator? He said, don't you know, Granddad, it's an imaginary lion running around the earth. Do you know, at this day and age, they're having sex education so early in life. And he came home from school and said, Granddad, do you and Granny have sexual relations? I said, well, sometimes. He said, how is it that we've never met them? And a granddaughter went to her father and said, Dad, how did I get here? And he said, well, there was this great big bang, and the gases cooled down, and eventually they formed water. In the water, a single cell evolved, and the single cell eventually became fish, and the fish changed into reptiles, and some of them left land and became birds, or they became animals, monkeys, and apes, and finally man. So granddaughter was a bit confused, so she went to her mother. Said, Mom, how did I get here? Mom said, well, God made the earth, he decided to put man on it, so he put down Adam, and Adam had Eve, and Adam and Eve had babies, and their babies had babies, and their babies had babies, and Mommy and Daddy were born, and so you're here. And the daughter was even more confused. So she went to her mom. She said, Mom, Dad says we came from monkeys and apes, and you say we came from Adam and Eve. Who's right? And Mummy said, as I was only talking about my side of the family. We took, my wife goes to St. Leonard's Church, as I mentioned in Bulletin, fairly regularly. And one day I decided to go with her. And Billy at that time was a little boy. And when the service was finished, the offertory plate came around, and I put hand in my pocket, and Billy shouted, Granddad, Granddad, don't pay for me, I'm under 5. And last one was, Billy, what happened today? He said, well, Granddad, you'll never believe, we came home from school and there was a fire. I said, really? A house on fire? He said, yes, a house was on fire, and I saw a fireman coming down pregnant. I said, Billy, what? Pregnant? What is pregnant? He said, don't you know Granddad carrying a child? But they give you the will to live. They give you joy. In conclusion, ladies and gentlemen, in this world, in this life, you can have the moon. Recognize it and grab it. Hold on to it. Hold on to the happy moments you have and frame them. Because cancer is so limited. It cannot cripple love. It cannot shatter hope. It cannot corrode faith. It cannot eat away peace. It cannot destroy confidence. It cannot kill friendship. It cannot fade away memories. It cannot silence courage. It's only cancer. Thank you very much.